If you're over 40, it's likely that you've started to experience more joint pain, muscle pain, weight gain, brain fog, and anxiety. And no, you're not just getting older. Your body is not getting the support it needs. And this is not just about hormones. Hi, I am Dr. Kristina Turkewitsch, and I'm a corrective care chiropractor in Newmarket, Ontario, Canada. I help women over 40 feel strong in their bodies again by getting to the root cause of their pain and not just covering it up. In this video, I'll help you navigate perimenopause symptoms like stiffness and pain and sleep disruption, mood swings, and instability. I want you to understand why solving this now is critical. If you've looked in the mirror recently and you've thought, why do I feel so much weaker than I did 5 years ago? And you're between the ages of 35 and 40, well, you're probably in perimenopause. Perimenopause begins when our hormones called estrogen and progesterone start to fluctuate and really over time decline into menopause when you completely lose your cycle altogether. And this can start really as early as 35 years old. Our progesterone already starts to decline. That's usually the first hormone for women that starts to decline. And this is because we're not necessarily ovulating at every cycle. As the number of eggs that your ovaries are producing start to decline, the brain then kicks into gear. And a system that has run, without interruption for many years has started to become interrupted. And this is when your brain and your nervous system actually start to change. And then what comes with that is those first symptoms of perimenopause. A lot of, potential sleep disruptions are a big one that usually start, and increased anxiety. The nervous system is actually becoming rewired. As these changes continue, our estrogen starts to change and fluctuate as well. As these changes continue, our estrogen starts to fluctuate because our brain is trying to stimulate our ovaries to produce an egg. Now, estrogen is super important for women. It is a neuroprotective hormone. And so what that means is that it's very nourishing to our brains and our nervous systems. And our bodies really rely on this hormone. Not only does it drive our reproductive health, but it strengthens our bones, it supports our heart health, it impacts our metabolism, and impacts our brain function. And so because of this, it affects our collagen production, our joint stability, our muscle tone, and our inflammation levels in the body. That's why so many women who are transitioning into or starting perimenopause, and then of course transitioning through to full-blown menopause, you will start to experience the perimenopause weight gain, belly fat and joint pain, muscle weakness and brain fog, and anxiety and sleep issues. But here's what most people don't understand. Hormones don't act alone. Your nervous system is going through a complete overhaul, transitioning essentially from a system that relies heavily on estrogen to a system that doesn't rely on estrogen as much. So it's almost like you're going through a withdrawal from being on, a dependent drug. But the thing is, it happens very slowly. And so that is why these symptoms can be drawn out over a decade and can start to get worse and more pronounced as you go along. Your nervous system helps your brain and your body deal with these transitions, and so also controls how your body adapts. If your nervous system is healthy and well supported, the transitions and shifts will go much easier for you. But if not, then your body can feel like it's been hit by a truck. If you're sitting for long hours at a desk, if you're under chronic stress, if you're sleeping poorly and carrying postural strain, or are under chronic anxiety, your body cannot adapt efficiently because your nervous system is overloaded. And when adaptation drops, symptoms increase. They go up. This is why ignoring symptoms of perimenopause actually increases the decline. Not because you're aging, but because stress, physical stress, spinal instability and stress, and hormone shifts really start to compound. I hope this made sense for you. And if you found this valuable, please give it a like and consider sharing. Don't forget to subscribe and comment if you have any questions. In the next video, I'm going to show you the hidden link between perimenopause, joint pain, and your nervous system, and why most women are treating the wrong thing. So check that out next.